This is table 4-6, and we're going over the femur.
So the femur is the best weapon in the anatomy lab. It's huge and carries a lot of weight. So it's a good club to have. But the head is very indicative by this ball. And you remember Suzette talking about the ball and socket. So here's our head. And then on the head, we have this fovea, this hole kind of divot in there, which you have a ligament that connects this head into our acetabulum on the os coxa to keep it in place. So really hard to dislocate a femur. The neck would be right around the head. And then, so on the back side here, this is posterior. So you can know when you see these that you're looking at the posterior view of the femur. We have the greater trochanter. Trochanter is very specific to the femur. So you're only going to use that word when you're on the femur. So we have greater trochanter, and then we have the lesser trochanter. And in between the two, we have what's called the intertrochanteric crest, which makes sense because inter is in between. So in between the trochanters, we have a crest. Then the shaft is the bulk of this femur here. And then coming down from the intertrochanteric crest, we have this rough patch right here. And anytime we have a rough patch, we know we're talking about a tuberosity. So this is our gluteal tuberosity. So this is where our glutes are going to attach. Then as we come down along that rough patch, we feel a line right there. And it has a little bit of porous in it. It's a little, there's some little holes in there. This is our linea aspera, so an aspirated line. And then as we come down, we start to make sense of our direction here. So here, this head is medial, this stuff is lateral. And then when you kind of think about how a femur should look in you, and I told you those are posterior, so these are facing the back. When you look at the front, you can kind of see that smooth edge, which would make sense. We're going to talk about our patella later, but the patella is going to sit right in front there. So this would be our anterior aspect here. So we have, I'm going to go to the posterior side again. We have, so here's our head. So that makes this guy the medial condyle, and that would make this guy the lateral condyle. And then we also have a medial epicondyle. So the epicondyle is upon the condyle. And then we have the lateral condyle, or epicondyle, which is sitting on the lateral condyle. Now, also on the medial side, we have a bump. Now, it's on the back side, and it's about 1 inch above, so about right there. And mine's not very great, but sometimes they're a little better. But so here's our epicondyle. So we're about 1 inch kind of on that posterior medial edge here. We have the adductor tubercle, and adductors are our groin muscles. So this is an attachment site for our adductors. And then the last term is right in between our two condyles. We have the intercondylar fossa. So a lot of directional terms going on down here. And rights and lefts, if you know that this is anterior and this is medial, you can kind of know that fits into our guy on the right side. Pull him out a little bit. So he would fit just like that.